So I picked some topic about preventive care generally that I see a lot of patients for. These are topics that are common questions, or they're things that I think that older patients should be thinking about, but maybe they're not getting with their regular primary care doctor. So I just picked a few different topics, but again, I'm happy to touch on other areas during our discussion portion. So this is sort of an outline for today. So we'll be talking about healthcare access, the Medicare annual wellness visit, some general tips about cancer screening, a little bit about vaccinations, substance use, hearing loss, cognitive screening, physical activity, and advanced care planning. So these are just a couple of things we'll try to touch on today. So we, as geriatricians, we think a lot about what healthy aging is. And so this is kind of what we might think of as an ideal healthy aging trajectory. So this is a Tal Porchon Lynch, who was a yoga teacher. She was the Guinness Book of World Records oldest yoga teacher. I believe she was about 99 or 100 when this photo was taken. So, she has maintained incredible flexibility. She's hovering off the floor, so she's very strong. So this is kind of what a lot of people think of as ideal, but is really not, this is not attainable for most of us as we get older. So we also in geriatrics like to think about healthy aging as also this person. So you may initially be a little surprised that I'm saying that, because this person's sitting in a wheelchair, they're needing help from their caregiver. But on the other hand, they're out at a social event and they're able to engage in this social event and get a lot out of this. And so we also think about in geriatrics that healthy aging isn't just exclusive to these sort of exceptional agers, but is really meant for everybody, regardless of whatever physical condition you might find yourself in as you get older. So just to sort of start out on with that premise in mind as we're thinking about healthy aging. And again, as part of a healthy aging framework, we like to think about physical, mental, and cognitive health, but we also want to think about social engagement. And then today we're really focused more on this orange area, promoting health, preventing injury, and managing chronic conditions to help promote a healthy aging journey. So I usually like to start out with talking about, a lot of this hinges on people being able to access primary care, which we know is really a challenge right now. And this might depend on the area of the country that you're living in. But I like to say, so primary care is sort of the foundational part of the health system. Primary care, on the other hand, is struggling right now. And so a lot of people are having a hard time finding a PCP. I usually say once you have a PCP, try to keep them and try to stick with it for a few visits as you get to know each other. A relationship with a good primary care provider it's just that, it's a relationship. And so it does take you a few times to get to know each other and understand each other. So try to keep the person you have, even if it might not be your dream PCP. We know that doctors, PAs, and nurse practitioners are all great options for PCPs. And you might work with a clinic where the doctor alternates visits with a PA or a nurse practitioner. And those are also good models to be in and can give you, more access to your team when you need it. It's good to write down your questions before your visit. A lot of times the visits are 20 to 30 minutes. So it's good to try to be organized, on both sides for the visit. Bring in all your medications so your provider can get a really good idea of, what you're taking. If you feel like you're not being heard or you feel like you need an advocate, it's not a bad idea to bring a family or a friend with you. I have most of my patients come with some other person. And so that's a very common situation that a lot of doctors are very happy to have the perspective of the other person there. And the person can also speak up for you if you're afraid to ask questions of your team. There's also something called concierge healthcare, this typically requires an additional membership fee, but this is an option for some people who who want, more access and better communication. So usually just like to say that that's an option too for patients if you're looking for a different type of service. So that's just a little bit about, primary care, and we're happy to talk more about this during our discussion as well. And then, so just the idea, so preventive care for older adults is actually a relatively new phenomenon. So you can see in 1980, that's when Medicare started covering its first preventive service, which was the pneumonia vaccine, interestingly. And then in 2005, they introduced this preventive exam that they started covering called the Welcome to Medicare visit. And then in 2011, we got the Medicare annual wellness visit, which is a very comprehensive visit that includes all different types of preventive care in one appointment. And typically this is done annually after someone turns 65 and they're enrolled in Medicare. So a relatively new phenomenon in medicine in terms of the big picture. In the past and still to this day, medicine can be very reactive. So you develop a problem or a symptom, and then your clinician is trying to respond to that and treat that. But it hasn't always been the case that there is really this comprehensive review of different aspects of prevention. So I think there's been a lot of progress made, but still, a lot of ground to cover. So this is, I like to say, if you're gonna, take one thing away from this, is just to ask to get your Medicare annual wellness visit. So sometimes we know that in this country, only about 15% of people who are eligible for the Medicare annual wellness visit are getting it every year. And so this is a great starting ground to work with your primary care provider on making sure you're getting all of the preventive care you need as you age. So the Medicare, I'll just break it down briefly, but these are the elements that are included. So it includes, medical history and medication review, which you get at most other types of visits too. But it also includes some different screens for psychosocial health. So screens for depression, anxiety, screening for substance use like tobacco or alcohol use. It includes a screen for intimate partner violence, social isolation. So these are all really important things that impact people's health, especially as they get older. There's also a lot of focus on health behavior screening. So physical activity, nutrition, sexual practices, motor vehicle safety, home safety. And then there's some really important screens for different aspects of physical health that become more and more important as we get older. So things like vision and hearing screening, screens for function and mobility. So what is somebody's falls risk? What does their walking and gait look like? And then we have cognitive screening, and then other review of immunizations, cancer screening, bone density, and then a focus on advanced care planning. So which we'll touch on more as we go along. So this is a very comprehensive visit, and if done annually, can be a really good way to just make sure you're getting everything that you need as you get older. I wanted to highlight a couple of specific issues. So one is the topic of colorectal cancer screening. So there's a preventive services task force called the USPSTF, and this task force reviews what are the benefits and the risks of different health screenings for the US population. So right now, colon cancer screening is recommended between ages 45 to 75. And that's typically done through a colonoscopy or through at-home stool testing with either the FIT or the Cologuard test. The colonoscopy is typically done every 10 years and maybe more often if you have certain risk factors, whereas the stool testing is done once per year. If the stool testing is abnormal, then that typically leads to a colonoscopy. So those are our options right now for testing. We know that the risks of colonoscopy, such as bleeding, intestinal perforation, and others, increase as we get older, and especially if we have a more complicated medical history. So this is something, once you reach the age of 75, it's really important to talk to your doctor about how do you individualize this to your health status. So we know so people benefit from getting colonoscopies if they have a life expectancy of more than about 10 years. So if somebody's in very poor health and they're 80 years old, for example, this might not be the right test for them anymore. So they might either choose to stop screening or they might choose to do a different type of testing. On the other hand, if you're 80 and you're in very good health and you have a long life expectancy, you might want to continue doing this type of screening. So this is just something, as you get older, it's just important to have that conversation with your doctor. And it's always okay to bring that up to your doctor as something you want to talk about. Another hot topic recently has been the RSV vaccine. So RSV is the respiratory syncytial virus, and this usually causes a cold-like illness, but it can actually be very severe in both young children and older adults. And recently, in the past, I think since 2023, we had 2 vaccines, and then there was a fourth one or a third one introduced in 2024, this mRNA Moderna vaccine. So currently, the CDC recommends vaccination for all adults ages 75 and above, and then also for adults ages 60 to 74 who are at increased risk. So this might be somebody who has heart failure or chronic lung disease, or if they have like rheumatoid arthritis and they're on a medication that suppresses their immune system. So there's a whole list of different conditions. And so the RSV vaccine, typically we get it in the late summer or early fall as we get into the respiratory virus season. And right now it's given as a one-time dose. But in the future, we think that we'll probably be giving it every few years to older people who are eligible. So this is something to think about. If you haven't heard of this before or your doctor hasn't brought it up, this is a new vaccine that probably provides great benefit to our older adult population. I like to talk about alcohol use as well. There was some interesting data that came out last year that was actually in the news a lot, but alcohol use is actually increasing among older groups, especially binge drinking. So there was a large cohort study that reported this, and I think like CNN and some other news outlets were talking about this a lot last year. So we know that older people tend to be more sensitive to alcohol because the way the liver metabolizes alcohol slows down as we age. Older people also tend to have some more medical conditions that can make drinking dangerous. So for example, if somebody has diabetes, especially if they're on insulin and they're drinking alcohol, you can actually get very low blood sugars, which is dangerous. And then typically people are just on more medications as they age, so there might be some more interactions with alcohol. And in the past, we knew that alcohol, when used moderately, might be protective against heart disease. But we know now through some more research that actually at any level, alcohol increases our risk for cancer and also dementia. So it seems to have different effects on different parts of the body potentially. And so the guidelines as we get older are really to drink less than or equal to 1 drink per day for women, and then less than or equal to 2 drinks per day for men. And some guidelines, such as those in Britain and the UK, actually recommend even less than that. So this is just something I think a lot of people don't know. So I usually just like to bring this up, for consideration. Hearing loss as well is something that's really important to pay attention to as you get older. So the most common cause of hearing loss as we age is called presbycusis, and this just means age-related hearing loss. It affects 2/3 of people ages 70 and older, and it actually increases risk for dementia. There was a clinical trial in people who are at higher risk for dementia who had hearing loss and then got hearing aids, that it actually reduced risk for further cognitive decline. So this seems to be one of the things we can actually control about our dementia risk. And so, this is included in the Medicare annual wellness visit, but if you notice that particularly if family members comment on hearing loss or you notice hearing loss, that it's never a bad idea to get some testing with an audiologist and see what's going on. Um, Hearing aids also, when people with hearing loss get hearing aids, we actually see that their depression, if they're depressed, that tends to decrease in severity. And it also reduces social isolation because they can participate more in conversation. So this is not just a convenience. This is actually really important to maintain that tissue in your brain that's receiving sound, because there seems to be something important about that is linked to reduced risk for dementia. So this, and a lot of people are kind of reluctant to get hearing aids. So I like to point out some of these health benefits to try to motivate them. And speaking of cognitive screening, I'll turn a little more towards this and talk about a few different points. But this is actually, so this is included in the Medicare annual wellness visit. If anybody's ever done one of these, your doctor will ask you to draw a clock and remember 3 words, and that's the screening test. If this is abnormal or if you have concerns about memory, then this should lead to more types of testing. So some longer types of cognitive testing. And if you feel like you're not being heard about memory concerns, you can always ask for a specialist referral. So that's usually like a geriatrician or a neurologist, depending on what region you're in. But this is never, if you have concerns too about a family member, you can always ask for this if you're attending the appointment with them. So there's, it's always a good idea to get this checked rather than to let it go. And I think this is also a great reminder to focus on brain health. And so I'll talk about a few different points related to this. So this is from a review that looked at different factors related to dementia risk. I'm going to talk us through this. So if you think about your risk for dementia being it's like 100%. So about 65% are things that we can't control. So things about our genetics, for example. However, about 35 to 40% are things that we can actually potentially work on. So there are some risk factors like in early life education that are really important to building up cognitive reserve during our lifetime. And so that's something, with this audience, we can't go back in time, right? But we can also help our grandchildren and our children think about this. So education is a protective factor for brain health. In midlife, we can work on hearing loss. We can manage our blood pressure. So we don't want our blood pressure to be too high because it can damage those little arteries in the brain. And then we can try to work on our weight. So reducing obesity can actually help with preserving our brain health over time. And then in late life, there's actually a lot you can do. So if you smoke, you can work on quitting smoking. We want to try to treat depression if that's coming up. We can work on physical activity. We can work on social isolation. And then if someone has diabetes, we can work on controlling that better, and that'll help the brain to function better. So those are just a few things we've seen through research that have come up over the years that seem to be really important for our brains. I also like to point out that we can work on medications. So there are different medications that can slow our thinking and potentially contribute to cognitive decline later on. So one is the sort of chronic regular use of benzodiazepine medications. So medications like Ativan, for example, Zolpidem or Ambien. This is like using regularly over many, many years is what we're talking about. Diphenhydramine or Benadryl. So this medication is what we call anticholinergic. So it affects a specific neurotransmitter system in the brain, and it can cause confusion, falls, constipation, difficulty emptying the bladder, dry mouth, and some other bad side effects. So that's one to really watch. Any medication with a PM has Benadryl or a similar medication in it. So like Tylenol PM, Advil PM. these all have these what are called anticholinergic medications in this combined with the Tylenol or the Advil. So that's just something you want to watch out for as well. NyQuil, same thing. It typically has one of these strong Benadryl-like medications in it. There's a medication for vertigo called meclizine, so that some people take this for dizziness. And if you take it regularly for a long time, it can have similar side effects. A muscle relaxant called cyclobenzaprine or Flexeril. So, and then, the opiates like oxycodone, morphine, hydromorphone, and others can slow down our thinking. So again, sometimes we do need to take these medications, but we want to keep them at the lowest dose possible and try to use them for the short term if we can. And then another thing, so for brain health is preventing something called delirium. So delirium is something that we see in a lot of our patients who are hospitalized. And you might have seen this in an older family member or relative. They're in the hospital, they're confused, disoriented. Sometimes they're very, very sleepy, or they can be very, very worked up and almost agitated. And so this is actually causing almost like an inflammatory response in the brain, and it can actually increase your risk for dementia later on. So if you do notice this, particularly in a family member, there's a lot of things you can do to try to help them. A lot of it is actually just being around for them. So providing kind of a familiar space, familiar environment, making sure they have stuff from home, they have their glasses, they have hearing aids if they use them. And this is a tip sheet from the Marcus Institute about delirium that kind of goes through some different considerations on how to prevent it, particularly if you find yourself trying to help a family member who has delirium. So I usually just like to point this out because this can happen a lot after surgeries or if patients are in the intensive care unit. So it's something you can do to try to help people that you love. Another thing, just to touch on physical activity. So we talked about this related to brain health, but there are actually guidelines for older adults. So after we turn 65, the guidelines for how much exercise to get change a little bit. And that's because we have some important changes in our muscle mass and some of our other physiologic parameters as we get older. So let me go to this next slide first, actually. So as we get older, we know that our muscle mass starts declining in our 30s due to different hormonal changes. And then our aerobic capacity, or our VO2 max, also starts declining, typically in our late 20s to mid 30s range. So our overall exercise capacity, it kind of peaks around our 20s, early 30s, and then it starts going down as we get older. So these three lines the blue is somebody who's sort of been a lifelong exerciser. So they're reaching a high peak, and then as they get older, they're declining, but they're still maintaining a very high level of function. Our red line is sort of our chronic, this person's been pretty sedentary. They're reaching kind of a lower peak, and then as they get older, they're at risk for losing some independence due to deconditioning. And then the green line, we like to think, and we know this from research, that we can, in our midlife and also our later years, exercise can help bump us up again to a higher level, so that if we do encounter a different, like a surgery or some sort of setback as we're aging, we can try to maintain our independence as long as possible. So that's where this idea for these exercise guidelines comes from. And so what are the guidelines? So a lot of us are familiar with this recommendation for aerobic activity. So getting about 150 minutes per more of moderate or vigorous activity each week, or each day. Each week, I'm sorry. So, and the way you can decide if you're getting moderate physical activity is if you can talk during your exercise, but you can't sing. So you can't really sustain your breath long enough to actually sing something. And then vigorous activity is typically only being able to say a couple of words at a time. So that's how you can kind of gauge your level of aerobic activity. So for a lot of people, as they get older, walking is actually a really good moderate activity. So it'll get you a little bit out of breath, so that you're still able to talk to someone, but maybe you couldn't sing a song, for example. However, so as we get older, we also want to think a lot about muscle strengthening. So this is body weight, or ideally weight bearing with free weights or those stretchy resistance bands. So ideally, we want to actually challenge the muscles to lift a weight that's heavier than our own body. So, and this is really ideally done on 2 or more days per week. But we know from the research actually that even just doing it once a week is helpful. So it's better than nothing. So this might be, you know, doing an online class or doing something at the gym. There's lots of different ways to get at this, but this is something that's really important to think about because our muscle mass is getting less as we get older. And then balance is also something that you have to think really intentionally about as you age. So our balance systems start declining more so after we turn 50. And this is due to different changes in the neurologic system and also the declines in other aspects of conditioning as we get older. So we want to think about doing activities that challenge balance. So whether that's standing exercises, Tai Chi is a really good exercise. Yoga with standing postures is a good exercise for balance. So this is just something to think about as you're kind of looking at your own physical activity regimen. So maybe let me just go over one more thing and then we can sort of open it up more for discussion. But the other thing that I think is really important to think about, and this actually for people of any age, but especially as we get older, is our healthcare proxy and power of attorney. So, and again, this is covered at the Medicare annual wellness visit. So this is something that your clinician should bring up to you. But if they haven't for some reason, or you want to think about this separately, a healthcare proxy is somebody that you choose to make medical decisions for you if you're not able to. And this comes up like, with younger patients all the time too. So like after a complicated childbirth, or if somebody's having chemotherapy for cancer at a younger age. So this is not just for older people. It's just that the situations tend to come up more commonly as we get older. And so this is the basic level of this is doing a healthcare proxy. And so you designate somebody as your healthcare agent. And that way, if the doctors need to talk to somebody because you're not able to communicate with them, they know that this is a person that you trust and you've designated them before whatever illness has come on. And typically, depending on your state, you can choose an alternate agent. So this is if the healthcare agent is unavailable or unable to serve for some reason. So it's good to think about who you would want as an alternate as well. A stronger version of this is doing a durable power of attorney with a lawyer. This is typically done during estate planning. And this is the healthcare proxy can be done by a member of your healthcare team, but a lawyer is typically completing the durable power of attorney with you. And so this is a stronger, more binding type of document that serves the same role. But the advantage of doing a power of attorney is it cannot be revoked in the moment. So it's just like a stronger binding legal document. So definitely, I know we touched on a lot of topics and we could talk a lot more about each one of them, but I hope this was a helpful sort of overview and maybe kind of a good jumping